Today, we're at 18.5 million cases and at least 326,000 deaths. This has been considered the deadliest year in the U.S. history. My question to you is, why are we seeing such an amazing surge of cases? And, what does that truly mean right now for us here in the tri-state? Should we be worried as well?
Yeah, I think it's important for everybody to understand that the virus is highly infectious. But it's being driven largely by human actions. If we were all to simply start wearing masks and socially distance and stop doing these mass gatherings, we would be able to affect the virus, and get control of it.
Yes, for sure. When we're talking about, especially this having a national mandate, are you looking at the federal government to actually, implement some measures such as the social distancing or wearing a mask for every American? Do you think that could be a solution to the problem?
It won't be a solution to the problem. I mean, this is a very, very complex problem. So there'll be likely multiple lines of effort. I know the Biden administration has already announced that for the first 100 days or so, they're going to ask the public, not mandate, but ask the public to wear a mask and socially distance. I don't think that's a big ask, and quite frankly, it's needed. I heard a statistic the other day that essentially said that we are losing a life to COVID every 30 seconds.
Yeah.
And it's terrible. We are one of the most technologically advanced nations in the world, and it's just very sad that we can't get a handle on this infection.
Parts of the nation are ravaging with COVID-19 cases. We have seen hospitalization like never before. How are you looking at these parts of the nation that are surging with so many cases? And, who is responsible for it at the end of the day?
At the end of the day, it's leadership. It goes from the president and his administration. It also goes to the governors of each and every state, and then also, there is an individual responsibility of every person in America not to pass this virus and to ensure the safety and health of their neighbors and their family.
Yes, for sure. I'd like to ask you about the conditions of hospitals right now. You're also an ER doctor, so I would like to know what is happening in your hospital that you're working at. But more than that, I'd like to know the information you're getting from all across the nation. What is the status on PPEs and hospitalization? Do we have enough beds? Are there enough ICUs? What do you have to tell us about that?
Yeah, no, those are all great questions. Now, with regards to PPE, I think we have a much better handle on PPE than we did way back in March and April, when we saw people, some of my colleagues and nurses wearing garbage bags because they didn't have gowns. There is still a shortage of I think, gloves and masks in certain areas, but I feel as a nation we're much better situated now with regards to PPE than we were earlier this year.
Go ahead.
Go ahead.
I just wanted to ask you about the impact you've seen it on the doctors themselves.
It's tough, right? I mean, I know a lot of my colleagues are working really, really long hours, and they're having to deal with some really heartbreaking situations. Seeing a mother or a grandmother in the ICU, not being able to breathe, not being able to say goodbye to their loved ones, not to have that connection with their family at their last moments of life is heartbreaking. And so after months and months and months of this type of work, I see a lot of our fellow healthcare workers also getting burnt out. It's a really, really tough job, even on a regular day. And to already be 8-9 months into this, it's definitely taking a large toll on our healthcare workers.
Yeah, definitely. And I'm sure it's mentally so exhausting to see that every single day for many of these health officials. When you're looking at the impact of COVID, again, we're looking at the fact that the next couple of months are going to be difficult. That's what all the health experts are saying. My question to you is, are we ready as a nation if it gets really bad in the month of December or January? What are you predicting?
We're going to see much of the same. We are already seeing a steep rise of infections, and that's all over the nation. So I think as we move into January and February, it's likely that we will continue to see a rise in infections unless we make some drastic decisions. What we truly need, though, is a national coordinated response. And that means we need leadership in Washington to coordinate with the state and local governments to get a handle on this infection. And for some areas of the country, that may mean a 3 or 4 week quarantine. It may mean that you may have to shut down certain businesses that are non-essential. So there's no good or easy solution. These are all difficult solutions.
Do you see the states of New York, New Jersey, Connecticut again becoming an epicenter later on?
Yeah, I think we're already seeing a very, very high rise in infections. Now, it's interesting because, at least, and this is just my own personal observation, it seems that while we are seeing more infections, that not as many people are getting as critically ill as they were way back in March and April. It's still bad. We're still seeing a lot of cases, but at least to me, it seems that the people that are coming in are not as sick as they were earlier on, and perhaps that's because we now actually have convalescent plasma, we have remdesivir, we sort of know, we have a few different tools now in our toolkit to fight this infection. So it may be a combination of factors, but it's good that at least my perception or my personal experience is that the lethality of this seems to be going down.
Wow, that's really interesting. The CDC today announced that they're projecting up to 420,000 deaths total by January 16th. Is this possible?
Oh, yeah. Yeah, it's likely that we will exceed, 600,000 deaths before this is finally over. Oh. It is a grim figure, and it is heartbreaking because what's not communicated when we're talking about these numbers is that each of these numbers is a person. Yeah. They have a whole family, they have friends behind that number, and it's a staggering number, and I wish it weren't so.
Yeah, for sure. This brings me up to one of the biggest news that everyone's discussing, a ray of hope, how we're looking at it, the vaccines by Moderna and Pfizer. I'd like to know how these vaccines have been evaluated, and also your take on the fact if they had enough participants in these, in these trials. Do you think that, made a difference in having an efficacy of 95%? Your take on it?
I believe that these have gone through rigorous testing. Does that mean that they're going to be perfect? No, no medicine is perfect. So I believe that they have a high efficacy rate, somewhere between 90 and 95% effective. The Pfizer vaccine seems to need a very, very cold storage, less than negative 90 degrees from what I understand. Whereas the Moderna vaccine only requires something like negative 5 degrees Celsius for storage, long-term storage. But I think it could be transported at about 40 degrees for about 30 days. So in terms of getting medication out, I think the Moderna vaccine will be easier to deploy and distribute. But I'm cautiously optimistic that these vaccines are going to do very, very well. Now, we all know that there have been a few cases of people getting allergic type reactions to them. And that's to be expected. That is, we see that in other vaccines as well. But I don't think it should scare anybody, when the vaccine's being delivered by a healthcare professional. We have medications to take care of potential allergic reactions. And also, it's important to note that there's, the rate of these adverse reactions or adverse events is very, very low. It's well below one in 10,000. So we, for everything that we know in terms of data that they've released to us, we know that the adverse reaction rate is low, that it is effective, and we're pushing this vaccine out to high risk populations right now. But I think it's important that everybody get the vaccine when it becomes available.
I'd like to know what you see as the difference between the two vaccines, if there is any, and also your take on, there were certain kind of individuals which were not included in these trials, such as pregnant women or children under the age of 16. How will we vaccinate those people? It's a two-part question.
So I have a friend who's also a healthcare professional, and she is currently pregnant. And I put the question to her just to sort of understand what her mindset would be. And she said, look, I understand that I'm pregnant, but I also understand that I'm taking care of COVID patients every day. And for her, it's sort of a balance between the risk and the benefit of being faced with COVID infection. So, I think everybody's going to have to make that difficult choice until more data is available. I personally don't have enough information right now to recommend either way. I think in the absence of data, it's probably better to proceed cautiously. Perhaps those populations that have not been thoroughly studied yet, perhaps not a great idea to necessarily have those people be vaccinated first. I know that they are having trials, smaller limited trials, right, to expand the types of people that are covered by the vaccine.
And there are 2 doses of this vaccine as well. The first dose has been given to about 1 million people already. Why are there 2 doses? And there's also a misconception that these vaccines inject the actual virus into the body. So I would love for you to address that as well.
Yeah, no, that's a great point to bring about. These, both the Pfizer and the Moderna vaccines do not inject live or weakened virus. Other vaccines historically used to use weakened virus to induce an immune response. But these vaccines use an entirely different method that uses RNA. So they induce an immune response to something that to a protein complex that is seen on the virus, and then your body then gets a little taste of that and develops a small immune response the first time the vaccine is administered. But it's not enough of a response to go into sort of the long-term memory of the immune system. So you need actually a second shot, a second vaccine shot, about either 21 or 28 days later, in order to really solidify that immune response. So there's a lot of things that we still don't really know. how long will you have immunity? I don't know. It could be 6 months, it could be a year, it could be 2 years, it could be longer. So that's one of the things that we are all going to be looking towards. And as we know already, there are different variants of this virus. In UK. They found a perhaps a more infectious version of this virus already. And there's no reason to believe that this vaccine wouldn't also help treat that or other variants at this time. So I think it's still a good idea, a great idea for people to take the vaccine. And moving forward, this may be something that we end up having to do, every year, maybe like the flu vaccine.
Oh, wow. Interesting. When we're talking about looking at the UK and this variant that has come out, there has been a news about the fact that it may impact and affect children more, this virus, this variant of the virus. And also AstraZeneca has come out and said that their vaccine would be hopefully effective against the virus. Could you give us a response to both of those questions?
Yeah, I haven't seen the data personally with regards to the new variant and how it affects children and other populations. So, I can't really speak intelligibly about that, but I do understand that there is a possibility that it is more infectious. AstraZeneca and the other vaccines should, in theory, work against these variants as well, as long as they have not mutated drastically. But again, that's something we're going to have to study. We don't have all the answers just yet, and anybody that claims that they have all the answers right now, I think, is mistaken. But what does seem to be a universally a good idea is to protect yourself, socially distance, and get the vaccine as soon as it comes out.
Is someone truly protected from the virus if they have taken the vaccine? And do you think they're able to transmit it?
That's a really great question. So as soon as you get the vaccine, it doesn't mean that on day one you're going to have immunity to the virus. It's going to take anywhere from 1 to probably a few weeks for your immune system to develop a response and a resistance to this coronavirus. I'm not sure that we truly understand how long that immunity will last. I know from studies that we've looked at patients that initially got infected back in February and March of this year, a lot of those people had antibodies in their system to the virus, and that those antibodies seem to have lasted between 4 and 6 months for most people. But now we're seeing, I've had several patients this week that have had their second round of infection. They got infected early on, and I guess for about six months or so, they were okay, and now they got reinfected. So you definitely can get reinfected once you've had this infection. So I think it's important to keep our guard up, and important to, again, wear masks and socially distance. Whether or not we can infect other people once we've had the vaccine, theoretically, you should not be able to transmit virus if your immune system's stopping it and not, replicating it, not allowing the body to replicate it. So, at least in theory, you shouldn't be able to pass it on.
If so, following up to that, I just want to ask you, should a person who has had COVID still take the vaccine? There's a news that came out about antibodies today saying that they can protect from the virus for up to 6 months. Your take on it?
Yeah, it makes a whole lot of sense for a person to have to take the vaccine, even though that they've had the infection. You don't know how long those antibodies in your body are going to last. So I think adding the vaccine to your toolkit, to your body's immune response, I think is a good idea.
Yeah, definitely. What do you say to people that are against vaccinations? There's a huge part of the society here in the United States that doesn't believe in vaccinating. What do you say to those people? How can you really convince them to take this vaccine?
I think we have to take a step back and understand, sort of what their fears are, and then really address them with scientific evidence and data, and say, hey, look, smallpox was a huge issue for the human population until science delivered us the smallpox vaccine. Right. Chickenpox is a great modern example. I know a lot of us have that are older had chickenpox when we were kids, but now with the vaccine to it, the human population doesn't have to endure that infection. Our kids don't have to endure that. Right. So it's about society. It's about being responsible. It's about doing the best we can for our kids. And I think that, and as well as our parents and our elders. So if we think about it in a larger community and societal context, I think it's important that we all take the vaccine.
Right. Many are looking at it as a light, from darkness. They're looking at it as at the end of this nightmare of COVID-19. I hope many people can understand what you just said and, get the vaccine. I only have 3 more questions left for you. The first question is, sure. There is a huge emphasis on getting kids back into school, even by President-elect Joe Biden in his first 100 days of agenda. My question to you is, how do you truly protect children that are not getting the vaccine, and then they are in these schools which, congregate so many people? What needs to be done to make sure they stay safe and protected?
A lot of things can be done in the school to minimize sort of the transmission and to do it safely. I think it's important to get kids back to school. Right now, when we're seeing very, very high levels of infection in parts of the country, I think those areas is probably not such a good idea to open up mass gatherings, including school, just yet. But when it comes to when we come to a point where it's the infection's under control again, I think what we do is we put into we allow the federal government and the CDC to give us better guidance on how we can open up schools safely. I think keeping windows open, once the weather opens up, improving ventilation, still having masks, and frequently sanitizing hands and sanitizing spaces, I think is a good basic approach that could be used. But again, I think the federal government and the CDC is going to have to sit down and come up with some national guidance, something better than, every state, you guys figure it out. Right. I don't think that's the right response.
Yeah, I think this incoming administration has a lot of work ahead of them, especially when you're looking at COVID-19. How are you looking at high-risk patients, especially that are South Asians? We've discussed this before too, people with heart disease, pulmonary infections, or with diabetes. How concerned should they be right now?
I think they should be all very, very concerned. If you're if you have underlying heart or lung disease, and you know that you have a weakened immune system, I think you really should self-quarantine until things start to get better. So regardless of what your state and local and federal government does, I think everybody has to take responsibility for their own health. And if you have a weak immune system, I think it makes a whole lot of sense for you to try to limit your exposure as much as possible.
Definitely. And finally, my last question to you is your prediction for the next 2 months, especially with this new variant, which we predict could already be in the United States due to the travel that has not been banned between the UK and the United States. What is your prediction What is the worst case scenario, according to you?
That's a tough one to answer. I think that there's probably a very high likelihood that variant, that UK variant, is already here because of the travel. And I believe we'll likely continue to see a rise in infections. We'll continue to see more death in the next 2 months unless we take some drastic measures. It's going to take a nationally coordinated response. It's going to take a lot of effort, and it's going to take some sacrifice. But I know that we can get a handle on this, and I know the incoming administration is going to work very, very hard.
Yes, definitely. I'd love for you to give a message out to all medical professionals and healthcare workers that have been working, along with you to really save lives on an everyday basis.
No, thank you. I think it's important that we engage in self-care as well, as sort of frontline responders. That's not just doctors, but nurses, everybody that works in the hospital setting, EMS, fire, policemen. These first responder agencies, as well as healthcare workers, are dealing with some really, really tough situations, stuff that they probably will not see in their lifetime again. So we need to support them. We need to support each other, and it's important that you guys take some time out and just decompress. Meet with your friends, go for a walk or go for a run. Make sure you take care of yourself.